right, welcome everybody. We are back this month to kind of talk about what now. Obviously, that's the title. What now? What do we do now? And I don't intend to spend the entire time talking about nothing but coronavirus, COVID stuff, all that. I mean, obviously, we have to talk about where we are to know where we're going. But we don't want to take the entire hour, or however long we're going to be covering, talking about just that. We want to really talk about and get into a discussion, a dialogue about what do we do now, how do we prepare, how do we, know what challenges are coming ahead and everything so that we can be ready, right?
Yeah.
Let's just start first and foremost with where we are right now. What's the current situation? Dispelling all the stuff, that you see on the media, turn off the TV for a second and let's talk about where we actually are.
Yeah. I know we're at 30 million unemployed now, or filing for unemployment. If you're friends with any small business owners, they're probably not too happy. Most of my friends who are small business owners are getting more upset by the week and talking about, the uncertainty that we're feeling. We just want an answer, is what they're saying, and they're not getting one. So they're rightly a little upset, and they're seeing other countries, especially Sweden. I'm sure we'll talk about them in a little bit. How they're hitting herd immunity. They're so close to hitting herd immunity, and they'll probably be back to normal completely within the end of the year
Without a vaccine.
without a vaccine. Oh yeah, and they're just doing the smart things that need to be done, and we're keeping people holed up, just delaying the kind of second wave that everyone keeps talking about, when meanwhile Sweden won't have a second wave.
Nope. Taiwan.
Yeah.
There's another one. They've reported, I just saw this the other day, they reported something like 6 deaths.
Yeah.
Total. They're right near China. So they were expected, they were supposed to be a hot spot. That they were going to get nailed just as bad, if not worse, than China did, because of how overpopulated they are. Right? That's the key. Oh, it's viral, so it's going to be overpopulated, so that's going to hammer them, and it didn't happen. So the interesting factor with that is that ironically they're not part of the World Health Organization. They were actually not allowed to join the World Health Organization because of their distress with China, and the fact that China is basically being shown right now to essentially own the World Health Organization. And when the president did what I feel is the right thing to do and defunded the World Health Organization, like he did Planned Parenthood, who was actually started by Bill Gates' father. Ironic how that works, huh? So Bill Gates steps in, and he said, well, we're going to continue to fund, because they're, of course, the Bill and Melinda Gates Foundation is the second highest funder of the World Health Organization.
Yeah.
So, isn't it curious that one of the countries that is outside of the World Health Organization's grasp had pretty much no cases?
Yeah, I agree.
Yeah, that's odd. That doesn't sound entirely viral to me.
No, and naysayers might say they're underreporting, or as we've seen here, and if you change the guidelines, you could be overreporting. So yeah, it could be a little bit convoluted there, but it is interesting that the people who don't follow the World Health Organization are faring a little bit better than everyone else.
Yep, it's crazy. They in talking about the overreporting, because you said the numbers. If we go back, we of course talked about this on our last video. How these things can very easily and quickly get blown out of proportion by changing diagnostic criteria. So back on March 26th, they changed the diagnostic criteria to where you only had to have suspicion in the United States, and this comes from the top levels from the CDC, saying that you only have to have suspicion to mark it on the death certificate that they died of COVID. Well, that becomes a massive problem when you see the conflicts of interest that are now out public knowledge. There's a lot of people that will shoot this stuff down. I don't think they're the majority. I think they're the minority at this point. But they'll quickly shoot this kind of information down that has exposed that hospitals are making something like $39,000 off of a COVID diagnosed cause of death case, as opposed to about $6,000 for a standard pneumonia.
Yeah.
So you put $6,000 in one hand and $39,000 in the other hand, and you say, well, we don't actually have to have a test to confirm it. Come on, I mean,
yeah.
Most people are going to go ahead and they're going to mark it as COVID, which might explain why certain pockets have these outrageous figures that aren't replicated anywhere else.
Yeah, I think Medicare said $39,000 for anyone that was placed on a ventilator. Mm-hmm. Is paid through Medicare, and I think it was less than $6,000 for regular pneumonia, but I think pneumonia associated with COVID was up there, $6,000 or $9,000. And it's a lot easier to claim that they had COVID and not test them than it is to actually test them and discharge them with COVID. So I do think that there's definitely a huge conflict of interest when you can make up to 4 or 5 times the amount of money based on a diagnosis you don't have to confirm. You could just label.
And even in terms of the number of cases that we have, that is being played out if you watch certain media. Mm-hmm. It's amazing how this, and I think we talked about this last time a little bit too, how this is not a pandemic like you would think of a pandemic where it's bipartisan. This is not a bipartisan issue. Yeah. This has become entirely partisan, where on one side of the fence you have a completely different view of the situation than on the other. Mm-hmm. And when you look at the numbers, you would think, well, cases are just spiraling out of control. We're continuing to see an upward trend and everything. But you got to also take into account that, an article that I saw today said, and I'm not. This isn't about touting Trump for his efforts or anything else of that nature, though, of course, one side will spin it in that direction all the time. Mm-hmm. This is just facts. This article said that by putting Jared Kushner into play, he had boosted from 5,000 tests being done a day to about 300,000 tests a day mm-hmm. since the time that he took into that position. Well, do the math here. If you go from 5,000 tests a day to 300,000 tests a day,
right,
you're going to have higher numbers.
Right.
So what looks like a steady increase is really easily seen as a rapid decrease.
Yeah, they really need to compare it to the amount of people tested, and it comes down to not just testing those who are sick. If you want a true lethality rate, if you want to know actually how deadly this thing can be, you really need to be out testing everybody, whether symptomatic or asymptomatic. Kind of like the study in Florida did that found that 8% of the total population that were in supermarkets, they tested something over 1,000 people. They found that 8% were immune. And then in New York, obviously it's going to be a little bit higher. They tested about 3,000 people and found that up to 13% have already had it and didn't know.
Was that that was Stanford, right?
In New York, yes.
Was it?
I believe.
Was that? I think that was a California study.
That one was lower. So that one had 4%, but the one in Florida was University of Miami, and then I'm not sure about the one in New York. But
yeah, but take your pick. I mean, there's multiple studies there mm-hmm. that show that the lethality isn't what it is played out to be. Yeah. And this kind of goes into the what to do now. Okay, on that issue particularly, should we be in that boat of going out and testing everybody, antibody testing everybody?
No.
And I personally, I know a lot of even chiropractors mm-hmm. that are going out there and they're starting to do testing in their clinics, antibody testing in their clinics, because, I mean, let's just admit it's trendy.
Yeah.
There's money to be made in it because people are willing to spend, $200 and something on a test.
Yeah.
But I'm sorry, to me, if I don't see people around that are having this and, that are, I don't know anybody in this area that's that's having trouble with it. I mean, I know there's isolated cases, but we have more patients that work in the hospitals that say nothing is going on than we do know sick people or definitely not dying people. So why would we go about pushing everybody to get this test for something that we also know that a lot of us already had, because we have again patients who have tested positive for antibodies.
Yeah, I agree. And go back to the hospitals. They're actually, I hate seeing these Facebook arguments, and I stay out of all of them, but they're comparing the rest of the nation to New York. They're comparing everywhere else to these hotspots. So they're saying stay at home, save lives. Well, our hospitals here are furloughing workers. They're sending people home. They've committed entire floors to treating COVID patients that just aren't there. Now, they are ready. They do have the resources in case we do see a spike, but they're just waiting. They're playing a waiting game, and everyone's saying, stay at home, save lives, don't be out there, don't be selfish. Well, the only one you're really hurting by not staying at home is yourself, and they really shouldn't worry about other people, in my opinion. But both parents work at a hospital here, and they are seeing obviously less patients because they're not doing elective surgeries. But yeah, we have the capacity; it's just not getting there.
Yeah, I mean, hospitals are going broke because they can't. It's like a restaurant. I overheard you listening to something, talking about the average profit margin in a restaurant is something low, in the single digit percentages. But and so restaurants can't survive when they're 75% reduced. So we're going to have all these restaurants that are going out of business. But likewise, it's happening in hospitals too. I mean, when you go and you cut their I mean, let's face it, nobody wants to go to a hospital right now. I wouldn't be surprised if we see that the overall death rate goes down in the United States.
Yeah.
Because of course we know that from the numbers, the number 2 cause of death in the United States is medical errors. Number 2 and number 3. It's one of the top. Yeah, I think it's number 3. It's medical error. Well, when nobody's doing any medical procedures, you can't have medical error.
Yeah.
So,
speaking of that, the other major causes I think also will go up as well, like suicide. And I do think depression's on the rise as well. Domestic violence cases, we've seen spikes in there. I did read a stat. It said calls to suicidal hotlines have risen by 1,000%. That's just crazy, and it's one of the top, I think 15, it's in there, of the causes of death, especially in younger people. And this isn't giving many people a bright outlook on the future to come. But we were
speaking of domestic abuse, that just reminded me. I saw another study where they tested a bunch of inmates, and they found that the 90% of the inmates tested positive for antibodies that
I'm
they
sure
had.
They did.
Yet none of them were sick.
Yeah.
None of them. They didn't even know that it was in the prison. Yet this vast majority have already been infected. So I think we can all kind of get to that point. And if you can't get to that point, man, you got to go and check yourself. You've got to really just step outside the box and start looking at this stuff for what it is. Stop making it a political issue. Stop making it an agenda-driven, partisan issue. It is not. It's a infection. It's a virus. This isn't political, but it has very much become that. And I want you to pay attention to this point that, when we talk about what now, where do we go, we should already be there. Because if you go back in time to when it all began, we were going off of models that said that we were going to have, millions of people die.
Yeah.
Right? And these were Bill Gates Foundation-driven models. We're going to have millions of people die. Then, of course, information started coming out that contradicted that. And it got dropped into the hundreds of thousands. And then it was 230,000 in the U.S. And then it was going down to 80,000. And then they changed the diagnostic criteria around the same time that they said, well, maybe it's only going to be about 60,000 deaths. Well, now that they changed the criteria for diagnosis, we've seen it now climb up over 70,000 deaths, and they said now it's going to get up to about 130. Well, of course it is, because we're coding basically everybody as COVID, even if they're not, because they can and they're financially benefiting from it. So, If you saw the numbers distributed across any large scale area more than they are just in New York and New Jersey, you'd have a lot more reason to be less suspicious.
Yeah.
But there's something going on there that just is not explained there. So, when we look at what to do with that, it's incredible that when there were hundreds of thousands of deaths, you really saw people still kind of going about their business. You didn't see hardly any face masks around here.
Yeah.
Yet it dropped down to 60,000 deaths, and now all of a sudden, Home Depot and Lowe's are marking the ground and making you stand outside the building, and everybody's starting to wear a face mask. But you see, even the choice of wearing a face mask, I don't want to get into calling out divisions, but you definitely see sectors of culture and community that there's a greater tendency to wear masks and others that are not.
Yeah, I think they've been pushed that way. I think they've been told to expect the worst. I think they've been told, don't go outside, you're going to die from this. Like, things like that. Don't leave the house in case, unless it's an emergency. And I know fear sells. I mean, the fear of running out of toilet paper. And now we have we had a shortage temporarily. The fear of a meat shortage. And then everyone was buying all the meat. Even the organic meat at some of these other places like Walmart, Winn-Dixie, was people were buying that up, and it never gets bought. But things like that, fear's definitely going to sell, and it's going to lead to the shortages of all these things that really never would have been given a second thought during any other time of the year.
It's like the market. It's panic driven and hope selling. It's the minute that we see that, there's no problem. You brought up the meat. They say that there's going to be a meat shortage. Everybody starts piling their freezers full. We try to order meat for our restaurant, and they say we can't get it for 6 weeks.
Yeah, and
because they're out.
I did see a video on the news, and it had people overstocked on meat, and they were tossing it all out. It was all going rancid and just wasted.
Yep.
Yeah,
and farmers are being told to dump their stock of milk. Just throwing out hundreds of gallons of milk. But then and that leads to where the president has to come on and say that they're going to keep the processing plants open. And declare that they must stay open because they're essential to try to curb these shortages, which is fear and panic driven.
Yeah.
It's mind numbing. So we should be open at this point. That's the point is we closed the economy, if you remember, for a 2-week period. 2 weeks is what we were told. Guys, you need to close down for 2 weeks because this is going to be the worst thing you've ever seen in your life. Those 2 weeks are gone.
Oh, yeah.
Was it the worst thing that you've ever seen in your life? It wasn't for me. I don't know too many people that would say this was, oh my gosh, terrible, unbelievable. It really, by the numbers, wasn't a whole lot different from the 2 weeks before or the 2 weeks after. But instead of conceding that, okay, it's over, we were wrong, they just move the goalposts.
Yeah.
It's like I explained it like the televangelist who says that the world is going to end.
Oh yeah.
And it's going to happen on April 14th. And then April 14th comes and nothing happens. And everybody ridicules the televangelist and says, "See, he was wrong." But this televangelist just says, "Well, it just hasn't come yet. I know I said April 14th, but I actually meant we need to close down for 10 more weeks." And everybody believes him.
Yeah.
Like there's something wrong with that picture if you still believe even after that.
Yeah, and it definitely was more warranted at first when everyone didn't know what was going to happen. The thing is, we are going to open up, whether it be, it could be next week, it could be in a month, it could be 6 months from now, God forbid, and we will see an increase in deaths. That's just a reality. I know Chris Chris Christie mentioned it, and he got some flack for it. But even if there was a 100% effective vaccine, there's still going to be some deaths when we open back up. That's not insensitive to say that. It's a fact. It's a reality. And the sooner we open up and stop, if we can keep it under capacity for these hospitals, we will reach herd immunity quicker. They're 60, 70% immune, and then we can allow the immunocompromised to come back into the society when we're already at herd immunity and it's not spreading like it was. That's just the smart thing to do, like Sweden's doing. But we've kind of just delayed the inevitable by sitting inside. And worse than that, we're not getting exposure. Like, everyone's buying all the cleaning products, hand sanitizer. They're not being exposed to a normal flora and gut flora and things like that outside the environment. So people won't have as strong as immune system once they get back out into society. People aren't getting the sunlight, the vitamin D. It's setting up for a disaster to go right back out. They should let people out kind of the healthiest ones first, immunocompromised, just stay home. And I think that's the way to go. We shouldn't be in this spot to begin with, but here we are. We should open up everything for us, for people that can. And if you can't have access to that, if you are immunocompromised, whether it's government provided or other people doing charity, have ways for you to get access to everything that you would if everything was open. So, like, food delivery for free for people that can't leave the house, or people that need Amazon packages. Maybe there's some kind of sterilization if they want before it gets in their house. Things like that set in place, I think would be a good idea.
Yeah, but again, going back to the partisanship of it, we call certain things certain names, but we don't call things what they are. So if you say something that goes against the grain, you're a conspiracy theorist. And you're wrong, and you want people to die and everything else. But at the same time, we're calling it quarantine when it's not quarantine. Quarantine is what you do with sick people. This is house arrest. House arrest is what you do with people that are otherwise capable, when you're telling them that they can't leave and that they have to stay at their home. That's, that should be, we are all adults. We're all, we're responsible for each other's health and well-being, yes, but that doesn't mean that we all jump off the cliff for something that might happen. We still should. I can't tell you can't stay home.
Yeah. But
likewise, you shouldn't be able to tell me that I need to stay home.
Right. Exactly.
Same thing with the vaccine that is coming. I can't tell you don't get a vaccine. If you want to get it, you go right ahead. I can't make you not. And I'm okay with that choice. But at the same time, you can't tell me that I must get it.
Yeah.
Because I don't want it. I don't care what it is that they come out with. I don't want it. Because again, it's a virus that we've already had around, that patients are already getting tested with, that we were sick back in January, and I'm pretty sure probably already had it. But again, it's a virus. It's just a virus. It's just anything else, and we get over it. If we keep our bodies intact and healthy, we'll get over it and we'll be just fine.
Yeah.
This is just exposing a lot of systemic problems that need to be addressed. And unfortunately, I don't think those things are really being addressed. So what do we do, now that we know kind of where we are? Okay, what do we do moving forward? How, what's first step? You've got a mom and a dad and 3 small kids that are sitting at home right now. They're out of work. They're about to go back to work. And what do they do to keep their families protected, healthy, from a bodily standpoint, first and foremost?
Increase your body's immune system and increase the effectiveness that it has to fight diseases, bacteria, and viruses. And there's tons of ways you can do that, and staying inside is not one of them.
Why is that?
Well, if you're in a bubble, essentially, you're not exposed to anything besides what's in that house. And I'm sure hand soap will be antibacterial. You got things in the water that keep it, free of bacteria. which can be good, but if you're constantly exposing yourself to that and killing your own gut flora, which has a huge impact on fighting disease and other things, it helps with neurology and brain health, serotonin production, all of that. But you're not getting the proper exposure to these things that you need to get. So when you get hit with an unknown virus, it's going to hit you really hard before your body knows exactly what to throw back at it.
There's a lot of information now coming out. They're finally starting to come out with studies that to us are completely obvious and really don't even require studies, but got to do studies everything. It has to be evidence based, if you will. But vitamin D, that's one thing you can do right now. Luckily we've seen from the get-go a lot more people going outside and walking, a lot more people on the sidewalks. I know in our neighborhood, all the kids every day, all out playing, and playing together, and probably exposed to each other just as much, if not more, as when they're in school. I mean, it's just been kind of normal. Our kids, they were never outside that much before because none of the other kids were out as much. So that's been good. But getting sunlight, closing the beaches, that was insane. I mean, just pure insanity. I mean, you're in a vitamin D saturating environment, being that you're exposed to so much sun. Not only that, but you're in a high salinity environment, which further reduces microbes and everything. That was just crazy, But luckily, the beaches are now open. At least they are in Alabama. So be working on boosting your vitamin D levels now. And guys, that's the key when it comes to flu season. Anytime it starts getting into the winter months, you got to kick up your vitamin D levels, because I don't care what it is that comes around. If it's a virus or a infection of any kind, high vitamin D levels are going to show that you're going to fare better. I mean, this is just easy stuff. So that's one thing you do immediately. Get more sunlight. If that means going and standing in an empty field by yourself, for social distancing, that's fine. You can wear less clothing that way.
What about a tanning bed?
Yeah, I mean, I'm not a fan of tanning beds. I don't think they're the same thing, but I know.
Yeah, that was a joke.
Yeah, I know some people would disagree with that. But either way, even if you just had to take it in a capsule form, you take your vitamin D. Keep your vitamin D levels up. Just if you're going to take vitamin D, make sure that you take vitamin K with it, because you don't want atherosclerosis, because you're absorbing calcium better out of your diet. So, so vitamin D, eating a healthy diet, of course, getting adjusted, boosting the nerve system, immune system in any way that you can in order to stay healthy. Any particular vitamins and supplements?
I mean, we've talked about vitamin C before, vitamin D as well as if you are suspect of being deficient in anything, obviously boost those up to normal levels. But as far as, we haven't talked about fats or anything or macronutrients, but I would recommend knowing your omega-3, omega-6 ratio and getting the appropriate dosages there as well. Anything to take away inflammation from the body. So eating a healthy diet that doesn't have these, soybean oil, vegetable oil, which is soybean oil, corn oil, anything like that, and sticking to natural, alternatives for fat, things like that. Everything helps. Avoiding too much sugar so your body doesn't have to compete between that and vitamin C. It all will help you. And I think if you had the healthy diet, the appropriate immune response would occur, say if you get this virus. And it would be a lot less severe than someone who, always is eating the fries and burgers and McDonald's every day. And I think that they would fare a lot better if they were to catch this, or not even show symptoms at all.
Yeah, a lot of doctors having a lot of good success with zinc also.
Zinc.
Because zinc, of course, helps support epithelial tissues.
Yeah.
I personally, I think if I were to have any form of upper respiratory infection, it doesn't matter what it is, we know that silver solution binds viral DNA, so it can't replicate. So anytime that we have a viral infection of any kind, we use silver products. We use it, not colloidal silver, but a silver solution. When we nebulize it, and that usually knocks out stuff very quickly. Are we saying that these are cures for COVID? No, we're not talking about COVID in particular. We're saying this is a virus. This is generic stuff. We're being led to believe that, you have to have a treatment for a virus. That is not true. Okay? There is no, where that thought process is leading to is that you must, if there's a new bacteria or a new virus, you must have a new vaccine for that virus. And until we get there, well, then nobody can deal with it.
Yeah.
And that's false. It's absolutely false. And that's, Gates is wanting us to close down for another 3 months to give them time to come out with a vaccine, because what are they afraid of? They're afraid that we're going to reach herd immunity naturally before they get a vaccine on the market and produced and into supply, just like happened with SARS. There was no vaccine for it, and we got over it.
Yeah, I think they're also starting human trials a little early, and they were projected next year to have it, but I think the pressure's on, and they're thinking this year they'll have one.
Yeah. Oh, I mean, the quicker we see the trends going towards a downslide, which we are definitely seeing. I mean, if you look at the curves, we've definitely flattened the curve. I mean, there is no upward curve anymore. Now it's kind of they're increasing testing and changing protocol and everything. It looks in an attempt more to sustain it, and keep it afloat, because the minute people start to see that it's going down, and the economy starts coming back online, they know darn well people are going to start to forget about it, and then they're at a serious disadvantage of being called out for the baloney that it is.
Yeah, and if you're one of these that are quick to, sign me up as soon as the vaccine comes out, take a second and think about that. If you're a healthy individual, and if you were to get this as a healthy individual, you haven't been tested for antibodies, you don't know if you've been exposed already, think, is a vaccine that they rush to market potentially more dangerous than actually being exposed? Not everyone's a candidate for it. In our opinion, we think it's a lot less than most, but really think if you want to be one of those first that get this shot that's been rushed to market because of pressure, that has had a lack of testing. The testing there isn't great to begin with these kind of things, but think about that. That's maybe wait.
And word is these are going to be different than any vaccine that's ever been done before. These are going to be modeled differently entirely. So, this is not just hey, we're taking a previous methodology and just doing the same thing with a different virus. They're looking at doing things completely different altogether. So we have no idea what the long-term effects are going to be. And then of course you get into even more of the conspiracy theories, that they're looking at technologies to use ink to essentially stamp a vaccine in instead of injecting it in, where they can use basically dyes that are able to contain and store information, so that now you can record vaccine history on the person's body instead of in physical records. You're getting into some really...
Oh, I could see it.
Really crazy stuff.
Yeah.
But, guys, that is... I get into arguments constantly. You do really good about, staying out of the Facebook arguments and such. It's not isolated to just Facebook, but, it astounds me how many people reject the idea that forced vaccines are coming.
Mm-hmm.
And they call it conspiracy theory. And it's like, you really are completely out of touch if you don't see that's where it's going. That is absolutely the agenda that has been on the platter for the last, multiple decades. They've been pushing towards this.
I think even if it was here, some might deny it, because unless it's presented by the news or as a concrete fact, you must take these or else there's going to be a fine. But I don't think that's what's going to happen. I think what's going to happen is they're going to subtly, remember this disease, remember how bad this was, and try to gain popularity before making it mandatory, which I think's already started to happen, especially with this one in particular, and as well as the measles one before. They droned up so much controversy and so much support that a lot of us, were pushing back against these and saying, hey, look, even, either the Brady Bunch, who had an episode about it, was either really insensitive show or it's really not that bad. And they were all talking about, there was another old show that we had seen where they made fun of it, and the kid had gotten it and missed a sporting event, and he was like, oh, couldn't you just call it typhoid fever or something that they're not going to laugh at? And he just had the measles. But my generation doesn't remember that, especially, and the older generation, like my parents, I don't believe remember that either. So it's the oldest of the old who was like, measles isn't that bad. They're not going to be around, in 20, 25 years. So I think that's when you might see a lot of this pushing toward mandatory vaccines.
Where, by the way, in my 15 years, I've always taken the opportunity when a patient comes in that's, 70 plus years old and they have written down that they have had measles, I've always made the point to ask them, so how was it?
Yeah.
I don't say anything more than that. I just say, so how was it? And they always say, it was nothing. It was no big deal. Everybody got it.
And that is a point. So that man or woman, they're immune.
Yeah.
If you got your measles vaccine 6 years ago, you're not immune. You need your booster every 5 years. And I don't know about you. I'd rather just get measles, be done with it, be immune the rest of my life.
Absolutely.
Especially if I'm not an immunocompromised individual. I would just be sick, quarantine, or keep myself sheltered, whatever, and then be done with it, instead of having to go back and get a shot every single 5 years.
Now, with that, the line goes that because of that stance, you're insensitive because you're not thinking about the people who can't get it. But guys, understand, that's the difference between quarantine and house arrest. Is the logical thing to do if you are you have a newborn baby. Well, let's just say you have a whole newborn ward in the hospital. Okay. Your average baby who has perfect APGAR scores, has no problems, no issues whatsoever, where do they go? They go into the room with the parents. But then you have a baby that's born many, many, many weeks premature and has failure to thrive. You don't put that baby in the room with the parents. No. Where do they go? They go into a protective bubble, and they go into quarantine to try to nurse them back to health. Now, just because that baby was born on that day, you don't take all of the healthy babies that were born on that day and in that hospital and put them into isolation also,
right,
in order to protect the one that was premature. That's completely and totally illogical.
You isolate the baby in a NICU, right? And you give him maybe his own little pod and everything, and you take extra care of that baby. Give them their own nurses, respiratory therapists, things like that, to take care of the baby with special attention. But you don't have to do that with everybody else.
And if you do that with everybody else, here's a situation in that hospital. How many times is that situation going to come around? You can't support the entire hospital based on those few situations that come around like that. However, if you have the rest of the hospital working functionally and all the normal, healthy babies coming in and out that are bringing money into the hospital, that are paying the nurses, now for that one that actually needs the attention, you have the staff and the finances to be able to take care of that.
Yeah.
But when you lock everything down and you strip everybody away and you say nobody can go near anybody and everything else, you collapse the entire system. And this is what we've been saying since the beginning back in January, that we cannot shut down the economy because this is what's going to happen. You shut down the infrastructure that's going to be able to hold everything all together. And all of it's done for a virus out of fear and panic, not out of any rational basis.
Yeah.
So, okay, so we talked about health. What do you do about, about your health and keeping that on track? And that needs to be something that you're acting vigilantly on every day. What about your finances? That's probably the biggest thing that's running people right now.
Yeah.
What should people be focusing on right now?
Investing. No, I think, in my opinion, I mean, we're still working. I can't relate to people that, are unemployed right now or are waiting on those unemployment checks. But I do think there aren't jobs out there per se, but I do know some people taking odd jobs and some people, working a temporary job just to kind of fill the gap. But as far as like things to buy and stuff like that, obviously don't buy more than you need to. Don't waste money. And it's hard for me to really relate to people that are that have been unemployed, because I haven't experienced that yet. But we do have a few patients, that have told me, yeah, some are getting checks, some aren't. I don't know. I would honestly try to save money, and that's hard for me to say because that's the cause of recessions when people don't spend.
Yeah. And, granted, that's not insensitive saying, that we're still working. Thank goodness we're still working. Number one, obviously all of our patients that are coming in are glad that we're still working.
Right. Yeah.
But don't think that we're not affected, because we've been cut down probably 30, 40%, where I know a lot of practices and businesses are down 80%, 90%. So, we're thankful that we're being able to work as much as we are. But that's it. Be very careful about spending. Be very careful about thinking that things are going to get better tomorrow. Okay, and you mentioned investing. I completely agree. I think right now, and I'll tell you, he could verify this, I stay completely out of the stock market. I don't like the stock market. I don't like gambling at all. I like short deals. So what is a short deal? It's something I work for. So I know I can control my labor. I know what I can do, but I can't trust that another company is going to be able to do the right thing with their resources. So I typically don't invest.
Yeah.
But right now is the time to invest.
It is.
This is one of those markets where there has never been not in 10 years has there been anything like this. So I look back at 2008 and I know I should have back in those days. And I didn't, because I also was younger, and I worked into the panic and everything else. But, when this is at the point that it's at right now, if you can securely put money into depressed markets, travel industry, oil, take your pick, banks, it's basically anything.
Yeah.
There's vast areas that are being affected by this. You got to realize is at some point everything's going to go back to where it was.
Yeah,
because wealth doesn't disappear.
No, don't invest though in the tech sector. They're all having record-breaking quarters. So
no.
Facebook,
don't
Facebook
invest
people.
in Amazon and Walmart, and
or Tesla when he tweets. Your stock will drop 10%. But I agree. Yeah, so I'm a dividend investor. I don't do day trading. I don't swing trade. I don't do any of that. I'm in it for the long haul. Everything's on sale right now. You're still getting about the same dividend per month per stock. But one tip: don't invest. If you don't have a little bit of a cushion, a little bit of a savings, because there are these bad days still too. Yep. Overall, it's been recovering. I think maybe up 45% in the last month from its bottom. But you're going to have these dips and you're going to have these climbs. So don't invest if you're going to need the money the next week. Because you don't want to have to invest, have to need the money for rent, and then have to sell when they're low, and then you're at a loss there, and you lost the money for rent.
But, if you've got that cushion, and you've got the expendable income,
Oh, go for it.
then you should, because this people are rightfully saying this is going to be one of the largest wealth transfers in history, and that's a terrible thing. Honestly, it's a terrible thing in that there's so many people that will buy into the panic, and they will sell and go into the hole because they're afraid of what's going to happen and really think that it's the apocalypse. But guys, we're going to get over it. Wealth, again, doesn't disappear. People will start to travel again. They will start to go on vacation again. We're not going to sit at home forever. The airplanes are going to start flying again. The cruise ships are going to start going again. I mean, all this stuff is going to eventually go back to operation again. So the profits will come back. We've just got to get past this, so it is a good opportunity, but don't throw your life away into it. Don't gamble your life away. That's what we're really saying. Be careful with. Do take advantage of, if there's opportunities to make extra money, don't just sit at home. A lot of people, they're just sitting at home because they don't know what else to do. But you can always find something to do. I mean, I know handymen who just go and fix stuff at house. Guys, right now, everybody is at home working in their garden, working on their houses.
Yeah.
I mean, Home Depot and Lowe's are crazy.
Oh, yeah.
So, do you think any of those people need help? Absolutely. Absolutely. And honestly, the ones that are out working on that stuff are really less likely to be worried about what's going on. They're just doing stuff to fill their time.
To keep them, busy.
So I know my garden looks better this year than it ever has before because I've had more time to be out there.
Or you could even build things. Like you could build a sofa or a coffee table.
That's a great idea.
Yeah.
Yeah.
Speaking of things to do, though, and odd jobs, one of my friends, she's an occupational therapist, owns a place on Hillcrest. They actually started delivering wine. So people order wine and they'll actually drop it off at their house in costumes, and they're finding a way to make it.
Wow, that's creative. I like that. Yeah, so I mean, there's definitely ways you can get about it. Don't but the propensity is for people to instead sit at home, watch TV, watch Netflix and Disney Plus, and and sit on the news all day. And so they're just getting fed bad news all day long, every day, which just further depresses them. Or getting into Facebook fights and everything else. Guys, there's plenty of stuff to do.
Yeah.
So use the opportunity. Be with your families. I mean, that's part of physical and mental health. Altogether. Don't think you can't have dates with your significant other. Have a date in the backyard.
Or go get takeout and eat it in the car.
Yeah. I mean, a month ago, my wife, I came home and she had made dinner and, made the boys sit inside, and she had like a candlelight dinner set up in the backyard. We had date night in the backyard. It was fantastic. I mean, Mother's Day, guys.
Yeah.
Pay attention.
Right.
There's a little tip for you. So there's just so much that you can. I just realized some might take that as having a date night with your mother in the backyard. That's not what I mean.
Oh, that's not it.
I'm talking about your spouse. Yeah.
Oh.
But hey, your mother might enjoy and appreciate it too. So there's just so much that you can do to pass the time, but at the same time, don't get used to it. Okay, don't get to the point where this just becomes normal. We need people not to think this is normal. They keep on talking about this new phrase, the new normal. Guys, there does not need to be a new normal. This BS about not ever shaking anybody's hand again. Are you kidding me? Yeah. We've been shaking hands for centuries, and the human race is still alive.
Yeah.
I mean, this is just absolute garbage. I mean, if you don't want to shake hands with somebody, fine, don't shake hands with somebody. But to try to tell me that I can't shake the hand of my brother, right, or my pastor or my friend, or I mean, what's next? If you can't shake hands, well, then you certainly can't give hugs, and you certainly can't kiss each other on the cheek. So basically what you're saying is the new norm has to be complete social distancing.
It has to be complete sterilization, which
Yep.
means sicker people.
Yep.
And I read that, like, stadiums at different universities and stuff like that, and are thinking about putting a seat in between every other person that's just empty. And
Airplanes too.
yeah.
They're saying you
I've
can,
read
you
that,
can
yeah.
pay on an airplane an extra fee to guarantee that the seat next to you is
Right.
empty.
Right, but just 1 year ago you couldn't do that. Like, I know plenty of people that would just buy that seat next to them, but you couldn't do that because they were losing money.
Yep.
But fear's definitely selling now. But I know a lot of these stadiums wouldn't be able to stay where they are. You know, they try to maximize the space already. If you're making them skip seats, they're going to have half capacity, and half capacity stadiums never make it.
Yep. Theaters too.
Yeah, as
Theaters
well.
are going to be. Don't invest in theaters.
Right.
I'll say that now. Do not invest in theaters.
Maybe
They're
drive-in
getting hammered,
theaters.
but they probably. I mean, I can't. I almost can't see theaters coming back.
Yeah.
It's been a long time coming, but call it the blockbuster era. It's almost over because people have giant TVs and good sound systems and everything at home,
Yeah.
and those are the ones that are going to the movies.
They'll have to innovate, or they're going to go under.
Yeah,
There's
I
gonna be
mean,
something different.
people that can afford $100 to take their family to a movie
Probably get a
can
speaker.
afford to have a system at home.
I agree.
So it's got to change. It's got to change. So, well, if there's any questions, are there any other points that you want to add?
No, I think we've addressed just about everything.
Okay. Yeah. If there's any questions that you have in specific, make sure that you message us. We'd be glad to answer them on any topic. I mean, this is really just making sure that you have a game plan. But the big thing is keep your heads up and just be ready to stand up. We need people to stand up and use their voice. I mean, you can't just stay docile. If you're sitting on the sidelines just waiting for it to pass, guys, realize the intention is it's not going to pass.
Mm-hmm.
They don't want to let it pass. They want to use every opportunity to strip more and more rights and pass the agendas on you. And the more you sit silent, the more likely that is to happen. So don't sit silent. Make a difference. Make a stand. Share posts. Share information. Be vocal. Yes, are you going to get some trolls? Absolutely. I'll tell you right now. I live with trolls. I mean, it's just a fact of life. Most of them, are people you'll never even meet. There's no point. You don't have to argue with them.
Fake accounts.
Yeah,
Richard.
I just call them trolls and
Move on.
go
yeah.
away. Or as some like to say, blow away, a little snowflake.
Right.
It's just a fact of life. But you should be still willing and able to share your opinion. This is America. But if you don't share your opinion, then they assume that they've got you. That you're just on their page because you're quiet. Yeah. If you're quiet, you're on their page.
Mm-hmm. Yeah.
Anything else?
I think that's it.
All right. Well, guys, have a fantastic night. Have an enjoyable week. And hopefully this will be one of the last 2 weeks that we have to discuss any of this stuff. And things will go back to normal before next month. If not, we'll talk about it more next month.
Yeah. Now, I don't think we actually introduced ourselves at the beginning, but if you wanted to say who we are.
Who are you?
Dr. Michael Buck. Dr. Jordan Moore.
Dr. Mike Bucknell. Have a good night, guys.